We have come here not just as individuals, but as members of civil society organisations that already make up the Queensland Community Alliance.
Over the past 9 months, the Alliance has engaged in a listening campaign in Ipswich, and overwhelmingly the theme that running through these conversations has centred upon the alarming concern for a general wellness in our Ipswich community. And this has been expressed through concrete issues such as the limitations and the gaps in access to health services, and in particular to mental health services.
With as many mental health service providers as we could, we met, we talked, and a collective impact model has been identified as the best way to begin to tackle this very complex set of issues. So what's a collective impact project? It's not consultation. Collective is all the diverse organisations, the health service providers, the neighbourhood centres, the churches, the faith groups, the unions, all of those who work in the space of providing service to one degree or another to the mentally ill and their carers and their parents and their brothers and sisters and aunts and uncles.
I've had severe mental illness for over 30 years. Really good friend of mine, his name was Dave. Dave rang the helpline 42 times one weekend. It was a Monday afternoon, his wife come around and told me. She went down to start the car and he was in the garage, hanging there for her to greet him. My daughter, who's about to turn 14, is now struggling with her own mental illnesses. And there's just nothing out there. We try and we keep getting knocked back. Our future generations are in our hands, because what we do and what we say now is going to make a difference. Thank you very much.
My husband passed away 15 years ago. He was diagnosed with depression and anxiety. Just before he died, the treating psychiatrist increased his medication, then made an appointment for 4 months later. He never made it and committed suicide 2 weeks before Christmas. My sons took his death really hard. They were depressed, suffered anxiety, and were drinking and abusing drugs. Anyone I took them to for help would just look at it as alcohol or drugs. If someone would have provided tools to me to help them, and if treatment had been when they needed and continued consistently, then our family would suffer less of the pain of the last 15 years.
This is why we build this people power, so that we can place a call, such as you have made, in front of the decision makers and then ask them to take action with us to answer them. Ms McKee, we'd like to acknowledge your leadership since our last gathering, helping us to come to the outcome of collective impact as a solution for improved mental health care in West Moreton. Will you champion the collective impact project in the Ipswich community? Will you help us find the resources to fund the project and commit staff time? Will you commit the hospital and health service to being a part of the consortium that will apply for innovation funding?
Absolutely. What we've seen over the last couple of months is a groundswell of people coming together to actually do something and do something different.
Aftercare truly believes that people with mental illness can live meaningful and fruitful lives in the community. We have a commitment to achieving that, and we will certainly support any action that happens in the Ipswich community from a collective impact approach.
Yes, FSG will commit. We're a community organisation. Mental health support is our primary focus.
Open Minds would be very pleased to do that. We have a strong service footprint here in Ipswich.
Yes, on behalf of Stella Johnson, the CEO of Camboon, we provide our commitment to the consortium.
I'm very happy to do that, and I'm very proud to be a part of a government that is taking such a proactive role towards mental health.
The board of the PHN is committed to the development of a regional mental health plan.
Do you commit to champion and take the proposal to the board on a collective impact project?
Yes.
Once you hear all of the impact statements by patients, you can't possibly say no to any of these things.
Last month, I announced a $35 million innovation fund I'd encourage the Alliance to work with the Westmoreland Hospital and Health Service and your primary health network to consider how this fund can support your project. I'm very happy to contact my ministerial colleagues in the Queensland Government to discuss how they can assist.
We will have the opportunity to identify the gaps that exist in supporting people with mental health challenges, and we can then work together holistically to provide a sense of hope for the future well-being of individuals and families and the whole Ipswich community.